Hey you guys, welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, one-on-one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I talk about things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. As we continue our antibiotic series, let's continue through some more of the Derm section, okay? Question number 1 states, the nurse practitioner has diagnosed the patient with non-bullous impetigo. The patient is asymptomatic and afebrile. What is the best first-line treatment option at this time? Is it A, Keflex? Is it B, Flagyl? Is it C, levofloxacin? Or is it D, mupirocin? Take a moment to tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down and ensure you're answering what is even being asked of you. So, here the stem of the question states, what is the best first line treatment option at this time? So, I always say if it's asking for a treatment, you need to run it back and see if they have provided you with a diagnosis. And if they have not, then you need to take it back a step further so that you can determine what the assessment findings are and determine a diagnosis, right? So, you know what you're treating. Here they have provided us with a diagnosis, and the diagnosis is non-bullous impetigo. But it's also asking you for the best first line treatment also. So you need to pay attention to those key terms because that can help you narrow down your answer choice, okay? And don't let those little terms be the reason that you miss a question that you know the answer to. So the patient has non-bullous impetigo. They're asymptomatic. They're afebrile. All right. So how do we treat impetigo in those situations? Your best answer is D, mupirocin, which is your Bactroban. You want to do that topical ointment as topical antibiotic ointment because it's non-bullous, and also they're afebrile. They're asymptomatic, right? All right. Question number 2. The nurse practitioner has diagnosed the patient with impetigo. The patient does express some fatigue and is febrile on exam with noted bulla. Based on these findings, what is the best treatment at this time? Is it A, doxycycline, B, Bactrim, C, cephalexin, or D, ciprofloxacin? Take a moment to tell me what you got. All right, so stem of the question, based on these findings, what is the best treatment at this time? Again, if they're asking you for a treatment, look and see if they provided you with a diagnosis. And it has been provided here in this question. The patient has been diagnosed with impetigo. The patient does have fatigue, a fever, and there's noted bulla on exam. So the best treatment option here would be C, cephalexin. So let's just pause for a moment. So on the last question, with the non-bullous impetigo, we said first line therapy was your mupirocin, your Bactroban, right? Ointment. So that is also something you need to pay attention to when we're talking about impetigo. Key description, maybe your the honey crusted areas or lesions or whatever. But that's the key identifier with impetigo. But if they're telling you bullous versus non-bullous, or if they say there's a bulla, that simply is the medical terminology for blisters, fluid filled blisters, right? So non-bullous is more of that mild impetigo. They don't have any systemic symptoms or anything because the last patient was asymptomatic. So it wasn't anything that was warranting oral antibiotic management, right? So we start as the first line with the topical mupirocin. Now in this scenario, the patient does have fatigue, they have a fever, and they have blisters, right? So with this, you're going to also need to systemically treat. So we want to give the oral cephalexin, also known as Keflex, which is the first line therapy of the oral antibiotics that you want to utilize if warranted for impetigo, okay? And then question number 3, The nurse practitioner has diagnosed the patient with mild rosacea. What is the best first-line therapy? Is it A, doxycycline? Is it B, topical metronidazole? Is it C, ciprofloxacin? Or D, topical clarithromycin? Take a moment and tell me what you got. All right, and STEM the question here states, what is the best first-line therapy? All right, still, they're asking for a treatment. First-line therapy, treatment. So we're looking to see if they have given us a diagnosis and it is mild rosacea. So then you need to consider what is first line for this. So in mild to moderate rosacea, the first line therapy is your topical flagyl, your topical metronidazole. So B is your best answer. Also, as always, I tell you, not only with antibiotics, but with any of your pharm, one, I always tell y'all just to study it by system so that you're not making pharm a completely different thing to review and giving yourself even more of an overwhelming factor. When you are reviewing a system, review your medicines together so it's one complete package. But when you are considering and studying medicines and trying to consider what group and everything they go with, make sure you're reviewing the generic and brand name. So if they provide it to you in either fashion, you're able to get it. Now, I will say that the AANP puts both medication names on there. So, for example, it'll say metformin and glucophage, you know what I mean? But say they have it like that on question number 1. If they speak of metformin again on question 20, it's just going to say either glucophage or it's just going to say metformin. They're only going to give you both drug names one time together. ANCC doesn't give you generic and brand. So make sure you are looking at both so that you're able to identify it in either fashion that it is shown to you, okay? All right, you guys, as always, I hope you found this helpful. Be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But y'all make sure to meet me back here. If you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. Or you can shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Okay. Don't forget the number 1 when you enter the email. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you are someone who prefers to study independently, I do offer a online review that is self-paced, designed for family and adult gero for both exams. It's also linked in the bio of this channel. If you need to do any practice questions and to gauge and test your knowledge, all of my QBank options and bundles are linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, I always say, give us a call or shoot us an email because all sessions are customized. So let's gauge what you truly need, okay? But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.